four faculty here for the CU PPT program. I'm going to introduce myself in a little bit more detail here in a moment. But we always like to start with just a little bit of session etiquette, some key points. I think everybody who is attending virtually is well versed at this point, but if you can, please make sure that your microphone is muted. Use the chat feature if you have questions. However, we will hold questions until the end of the program. We actually have time built in this morning for questions and answers amongst all of the faculty who are presenting. So just kind of jot down, put a pin in a question that you might have as it arises, and there'll be time for that. You'll also be doing some tours with our current students, and so they're a great resource and a great group of folks to ask questions of as well. Right, so also just kind of really quickly, like who's here? Maybe let's kind of quick show of hands. Who's thinking of applying to physical therapy school this upcoming cycle starting in June? All right, looks like, gosh, at least 2/3 of you. How many are thinking in the next cycle or next 2 cycles? All right. Anybody here just exploring if physical therapy is potentially the right career path for you, which is perfectly fine. Excellent. All right, good. Well, welcome. But again, feel free to ask questions of the students later today, of us. We're happy to talk about the profession in general. Pretty great, although I guess we're probably biased. Right. And maybe also curious, like, let's see if we could quickly figure out who might be from the furthest away. Anybody from 3 states away? What state?
Florida.
Florida. Oh, you're in the running. Did anybody beat Florida?
No.
Where were you two from?
I'm from California.
California? Oregon, great. How many are from Aurora, who came like 3 miles or less? Awesome, welcome. We have our spectrum. All right. Maybe just quickly in the chat, a couple of Zoom people, where are you zooming in from? What states?
Washington,
Washington,
Florida,
right? Florida, Texas,
DC, New Orleans, California, Utah, California. Okay, that's good.
All right,
Okay.
great. Well, again, welcome to everybody, whether you're from just a few miles away or from a lot of miles away. We're happy that you're here. So here is the agenda. More of a formal presentation here for the next hour and 45 minutes. We're going to get some program information, and then we'll finish the formal presentation with specific admissions and information. Then there will be an opportunity for question and answer amongst those of us who are here from the faculty. And then we'll move into the campus tours with current students from 11 to 12:15. As those tours ended, the morning's activities conclude, and you will be on your way to enjoy what appears to be some amazing spring weather. All right, so as I said, my name is Joe Palmer. I'm the Director of Clinical Education, meaning I have oversight over our kind of the third of the curriculum for PT school in our program, really any PT program, surrounding the clinical experiences that students have to do to get that real world hands-on experience. So we'll talk a little bit more about that. There's always quite a few questions surrounding clinical education programs do it differently. And so we'll talk about the way we do it for CU. But first, they say that a mimicry is like the highest form of flattery, right? Like copying somebody. So our program director, Dr. Michael Harris Love, had a very similar slide that I was very inspired about his journey. So I thought I would share my journey with you all. And in part, it's just to show you that it doesn't have to be this straight linear path into physical therapy. We're about to see mine was very much not linear. So I'm from Colorado Springs, went to Doherty High School. Any Doherty High School Spartans in the? There hardly ever are. One of these days there may actually be. All right, so born and raised in Colorado Springs. I started my undergrad experience at the University of Northern Colorado. Go Bears. I was going to be a high school history teacher. So that was my major. But then I was a lifeguard and ended up working with folks with multiple sclerosis. And it was life-changing for me. getting in the water, interacting one-on-one with this individual with MS. And I really, really enjoyed that process and that opportunity to get to know that person. So I did a complete 180, changed my major to biology, then to kinesiology. And then I was thinking, well, maybe I'll just go to medical school. So I transferred to Colorado State, changed my major to exercise science. Then I thought, well, it's hard to get into medical school, so I guess I'll join the Army National Guard to get medical experience. And so I was a medical lab technician, and then I went on to become a flight medic. And I did my time at Buckley Air National Guard Base, just right over there down the street. So I got to fly around in helicopters, which was a lot of fun. Went back to Colorado State, changed my major to microbiology because I really liked that part of the lab tech training I had in the Army. Out of crisis that I didn't want to go to medical school, transferred back to UNC and majored in therapeutic recreation. And I actually finished and graduated many years later than it typically takes somebody with my bachelor's degree in therapeutic recreation with double minors in history and biology. Yes. Major success. Then, after a couple years working as a recreation therapist, I decided I wanted to go to physical therapy school. Applied to Slippery Rock University. It was one of 3 doctor of physical therapy programs at the time. So I'm definitely dating myself a little bit. Went to Slippery Rock, got my DPT. We moved back to Colorado Springs, and I worked as an acute care physical therapist for a couple of years. But was in really close contact with a very good friend from PT school who was from Wenatchee, Washington. She wasn't from Wenatchee, but she took a job in Wenatchee, Washington, which is in central Washington state. So we ended up moving out there, and I worked in Wenatchee, Washington for 8 years in a hospital system. So I did primarily acute care and subacute rehab, but then I transferred into the outpatient division and did orthopedics, worked with neurologic patients, and did a fair amount of wound care. How many of you, is that the first time that you've heard that physical therapists can do wound care? You all know that already. I didn't know when I started PT school, I was like, we do what? I'm never gonna do that. And then I ended up doing a lot. But then ready for kind of something different, and the opportunity to move into academia kind of fell into my lap. And so we moved to Spokane, Washington, where I worked as the director of clinical education 5 years. But my wife and I are both from Colorado, and the opportunity to come back home presented itself. And so I took the job here at the CU Physical Therapy Program in 2017. And I kind of forgot in my whole journey, I did like Army training here in this space in that building when it was still an Army hospital base. It was Fitzsimmons Army Hospital. But now it's CU Physical Therapy. So really full circle coming back here. Just recently finished my PhD in education. So that's my story. Not linear, and that's okay. My parents are okay with it now. They were like, now what's your major? But I think it's important to find yourself and find kind of what authentically resonates with you. All right, so we're gonna move into just a little bit about what is physical therapy. I'm guessing everybody who's listening to this presentation have varying levels of that understanding. But at its core, we really are a health profession that's focused on the restoration and maintenance, as well as the promotion of physical function. We're the movement experts. We do this by enabling optimal performance, working with kind of things that aren't working particularly well for an individual. And we're doing that through movements, or even kind of thinking about what are all the systems within the human body that contribute to human movements, and how can we address things even at that system level to optimize or improve human movement. Right, so think about, as you're walking around your tours today, how much is going on just with walking? We take walking for granted, but there's so much that's having to happen at levels that we don't have any real conscious thought about, right? But the balance to even be upright on our feet, all the different muscles that are having to be turned on and turned off at just the right moment to propel us forward. The way our brain is interfacing with the world around us, the muscles in our body, taking in that information. So much is happening. It's pretty cool. It's pretty fascinating. But that's really then where we come into play as experts of really appreciating all facets of human movement. How can we make a difference? One of the things, and I have some notes that are terrible about following notes on slides. As physical therapists, and I think this is a really great thing about the way we do education for our program or for our profession, is students, when they finish their Doctor of Physical Therapy, they are generalists. And what that means is you're not forced into a box that you have to specialize with orthopedic conditions or with kids or with more neurologic conditions. When you graduate with a base knowledge about all of those things. You really can work in lots of different practice settings right out of the gate. Or kind of move around like I did, where I did some hospital work and then moved into some outpatient work. Really, the sky's the limit. You probably can tell a little bit from my story, I get bored a little bit easy. And so it's really nice to be able to kind of work with different types of patients. And we have that ability as physical therapists based on the structure of our training in the DPT. So when we're everywhere, I think a lot of people associate physical therapy with maybe outpatient clinics. I'm guessing a number of you have maybe gone to physical therapists for maybe a sports-related injury, or you have a loved one who has gone to an outpatient clinic, whether it was part of a hospital system or even just a standalone clinic space in just a strip mall somewhere in town. But we're so much more than that. We work in hospitals, we're working in intensive care units, we're working in schools. Pretty much every school district has physical therapists to allow children with disabilities access to the educational system. We're in skilled nursing facilities. We do home health, where we're actually going to people's homes and providing therapy in that space. So there's, again, so many different avenues that we can work as clinicians. We can focus on kind of specialization for like the vestibular system, so that inner ear that results in significant dizziness. Public health is another area. Wound care, I mentioned. And so many other ways that we can choose to specialize, or again, we can remain generalists, where we're working with a larger variety of patients. So what does it take? Again, some of you probably are very aware of these requirements, but for some, this might be a little bit new. Physical therapy school, this is true across the United States, not unique to CU. It's a graduate degree. It's a Doctor of Physical Therapy. And so to be eligible to come into this graduate program, you have to have completed a bachelor's degree. There's really no one thing that you have to do your bachelor's in. But you do also have to meet certain prerequisites. And this is something Laura will talk about in more detail for our program, but always something you really want to pay attention to, because there is no universal prerequisites across PT programs. So as you're kind of shopping different programs, make sure you understand what prerequisites are required for each specific program. Our program is 2.5 years. Most DPT programs are 3 years. So after you finish that program, then you're eligible to sit for the national licensure exam. Once you pass that, you apply for license in your state. So we have 2 options in the CU DPT program, and I'm not going to talk much about these because I have wonderful colleagues who are going to go into more detail about each of these. But we have our residential pathway here on the Anschutz Medical Campus. And we have a new hybrid program, a pathway program. I'm trying to get it in my head. That Dr. Dan Malone is going to talk about. This is based at UCCF Colorado Springs. Our parallel curriculum and parallel resources between the 2. I'm going to just leave this part because Dan and Michael are great. So a little bit about just like the big picture of our curriculum in CU physical therapy, and this is true for both pathways. So you don't have to separate out, wait, is that residential, is that hybrid? The intention and the work that we have done is that it's one program, 2 pathways. And so I'm speaking about the curriculum at the program level that covers both pathways. So as I mentioned, our program is 2.5 years. We start in June and then we graduate in December every year. It is year round, so there are no summer breaks. And really, there's no part-time option physical therapy school is a full-time job, and I think it's really important that you go into the program knowing that. And I think as you talk to our current students, they will certainly attest that it's a lot of work. The work is very worthwhile, and I think people enjoy the work maybe a little bit more than undergrad because you're doing things that you're excited about, and you're learning things that you're excited about learning, right? You're not just jumping through a particular hoop, but it is a lot of work. The general components of our program, and we kind of start with the foundational sciences, anatomy, everything we do. For movement experts, it's all rooted and grounded in human anatomy. So we really start out with a deep understanding of human anatomy. And then some of the basics about what basic skills, basic exam skills that we need as physical therapists. And then we start layering on top of that. What's different in PT school compared to undergrad is that everything kind of comes back and reconnects. And so we're just layering and building. And so something that maybe you covered in the first summer, we're going to touch back on the following spring, and then maybe again the next fall, as we just kind of grow into the depth and complexity and nuance of what it is that you're learning. But you don't get to just memorize things and then dump it. Like, at least that's sort of what I did sometimes in undergrad when I just had to jump through the hoop, pass this class. And I'm pretty sure I'm not going to use this ever again in my life, except for maybe Jeopardy. PT school's different, right? And then after we kind of build that foundation, we start moving into patient management skills, kind of happening concurrently then our professional topics, and again, clinical education. And I'll talk more about clinical education here in a moment. This is just a snapshot. There's no test on this, but this shows the snapshot of our first year of DPT school. So you see summer one, where again, we're really looking at some of those foundational courses, clinical anatomy, examination and evaluation, foundations of intervention, but also starting right at that foundational level, talking about professional development and health promotion, wellness, which we've also really come to appreciate the importance and value of our role of physical therapists within larger society. And so we've added a health profession and wellness. When we move through the fall, kind of still growing on that foundational skill set. You're actually in the clinic for the first time that fall. And then in the spring of that first year, we start moving into more of the foundational, or sorry, the clinical track courses. Then at the end of the first year, you go out for your first full-time 8-week experience. Our first year students, you'll meet a few of them today, are launching in about 3 weeks for their first full. The other thing that I think makes our program really special and unique is this idea of professional education. And again, this is at the program level. So this covers both the residential pathway as well as the hybrid pathway. But we have the opportunity for our PT students courses in an interprofessional format with all the other health science students that are on this campus, medical students, dental students, nursing, PA, pharmacy, the past anesthesiology assistants. I think even some masters in public health have been able to be involved in this. But you're placed in teams of about 8 students per team, and you work through topics that are relevant to all of healthcare. So the first semester is really exploring topics related to patient safety, communication, kind of in an interdisciplinary team. And then the second semester is really focused on medical and health ethics. And you're working through this and getting to know where do we fit as physical therapists within this larger puzzle of healthcare, but it's also a great opportunity for these other health professions to understand who we are and how we fit. We also have the CAPE. This is an acronym for the Center for Advancing Professional Excellence. This is it's very stress-inducing for the students, right, if they're about to do it, but they all talk about what a valuable experience it is after they're finished with it. And what the CAPE is we have professional actors, who we call standardized patients, and you as students work through 3 different cases twice. You do it in spring 1, just about 6 weeks or so before you go out to your first clinical. And then you do it again in November of fall 2, again, just kind of a little bit before you go out to your second clinical. These encounters are recorded, and Then we have the students watch their own encounters, really self-reflect about what went well, what can they do different. And again, to be honest, if all of us did the CAPE, there would be things that certainly we could work on as well, right? And then there are 30-minute coaching sessions with a faculty member or one of our lab instructors to really dig into each of those 3 different encounters. Talking about, again, what went well and what are your goals as you're moving forward into your career. It's a fantastic learning opportunity. All right, the thing near and dear to my heart is the clinical education piece for our program. So we have 38 weeks of full-time clinical experience. And I will say too, as you're shopping different PT programs, and I hope that you are, I think it's important to really compare and contrast to think about how is this particular PT program structured to who I am as a learner. Success. So I would say from a clinical education standpoint, there's kind of 2 schools of thought. You can either put all of the clinical education at the end, the idea of let's teach everything in the classroom. You kind of know it all in your heads on some intellectual level, and then you go out and you do multiple clinical experiences, put that into practice. So that's one school of thought. The other school of thought is let's embed the clinical education experiences throughout the curriculum. The latter philosophy is how we do it at CUPT, and it's certainly a philosophy that I have personal buy-in. I think it enriches the classroom experiences. I always like to talk about this concept of tone. Tone is a condition that can occur when somebody has an upper motor neuron deficit, so brain or spinal cord. It's really difficult to teach tone in a PowerPoint. Like we can talk about it, we can talk about the modified Ashworth scale for how we grade tone. You got to feel tone to understand tone. And so that's really the point of early clinical education experiences. You're in the clinic, you're working on real patients, and you're taking this real world information and bringing it back into the classroom. PT students could probably do a second career as actors because we have to play patients for each other throughout the time in the program. But we can only go so far. Typically, our PT students are pretty young and healthy, and so it's difficult to practice doing dependent transfer because you all are just too helpful for each other. So really getting that experience out in the clinic is important. We do have clinical sites throughout Colorado and the United States. And as a program, we are committed to addressing both rural health shortages as well as experience with historically medically underserved communities in the state, across the country. So because philosophically, we have our clinical education embedded throughout the curriculum. In the first year, we have 2 clinical experiences. Our first integrated clinical experience, abbreviated as ICE, actually happens in 2 weeks, 1 week in September of fall 1. So the second week of September, the second semester of your second week of your second semester, you're out in the clinic with 3 other classmates. So you go out in a team. And you're in the clinic appropriately working with patients to your level of knowledge. And then you're guided by a licensed physical therapist. We call them clinical instructors in our world. Then at the end of year 1, I already talked about, we have 8 weeks of full-time clinical education experience. We go individually, kind of again, throughout the state. Some people are going, I think the farthest we have a student heading out to is in Boston here in a couple weeks. Then you come back, finish up the summer semester, summer 2. Then in October, you're going to do a second ICE experience, same team that you were with that first ICE experience, but in a different practice setting and with a slightly different focus. Again, we're really trying to move some focus towards community health, population health and wellness. And so there's going to be a larger component of that in the ICE2 experience. Midway through the second year of our PT program, you go out for your second full-time clinical experience. It goes from early January, typically January 2nd, through the first week of March is kind of the typical. Okay. Then you come back, finish up basically a semester and a half back in the program, and then you go out for your final 16-week clinical. The entire fall free semester. We do have an option called the year-long internship, and this is purely optional, But some students, rather than just doing that CE3 16-week experience, graduating, they can go back to the same clinic that they have been at for the last 16 weeks. But now they're returning as a licensed physical therapist. But for the following 8 months, these first 8 months as being a licensed PT, they're getting formalized structured mentorship. And so this is kind of what that might look like. And again, this is an option in our program. It's not a requirement. But you do that CE3 for 4 months, graduate, there's kind of a short period to get your license. Typically people are licensed in January, then you go right back to that same place they were at for the last 4 months to do an additional 8 months with focus and mentorship. And that is my piece. I'm going to turn it over to Dr. Michael Harris Love, and he's going to talk in a little more detail about the residential program.
With me? Welcome to CU. I had a chance to meet a few of you to start. Really happy to be here. Again, I'm the director for the residential, not the hybrid. You'll need the hybrid director soon. I also wanted to mention that I direct a lab here that deals. Also investigator at the VA. So if you might be interested. Feel free to reach out to me for this session. We can talk about those options. There's also a dual degree program in terms of the DPT. Master of Public Health. I think next year, exciting things are happening at the university. Talk about my career, which looks something like that. I won't get into the detail of it. Well, I'm curious. We're all here because we have a common interest in physical therapy. So I want to share why I'm interested in physical.
Yeah, so in my current job, I work for a for-profit company, and I realized that a lot of things I do doesn't really translate to helping people, and all I do is really making one person richer, and that doesn't align with my values and what I want in my life. I like sports, I like helping people. That's why I'm looking at the DPT program as a career path for me to fulfill that value, that goals of my life.
Having a career that's aligned with your values, that's a luxury and you should pursue it. And it wasn't direct for me. I had about 6 majors as well on my way to physical therapy. And so if you are clear on that, then congratulations. So I'm interested, like, obviously you're going to apply to a physical therapy. What do you think are the important factors?
Empathy,
Say again.
someone who has empathy.
Others? Please.
Someone altruistic.
I'm sorry, say it again.
Someone altruistic.
All right, altruism, good. Others?
An adaptable problem solver.
I think you'll have better kind of criteria than people who are going to review the application. You're doing great. Okay. So yeah, you do want to think about like what does an ideal PT student look like? That might be an odd thing to state, but it is a profession started by women and most people are. You know, we're going to talk about grades a bit. You are not your grades, but your grades are a part of your package, and so that's something. Your extracurriculars, have you found a way to kind of round out your experience, and more importantly, to tell your story? It's hard to convey that in an application, in a paragraph. So that's a challenge. Also mentioned that a strong network is important. You have letters of recommendation. As when we talk about equity to access and who has ability. That's an important element to your process. And resources. So Joe already shared, this is a full-time job. So if you think about where you want to make sure that the proportion of outside work is relative to the time you have available, right? So that combination of scholarship, financial aid, and some work in capacity will really flesh out. And our scholarships, I think this is. Trying to keep that debt down. And I would add family support, you know, and we're all at different places here in terms of family, like some may have families now. Others may close to home. But that support, whatever it is, and whatever your version of family looks like, I think is an important element to ensure that you're successful. So again, this is what success we think it looks like, and this is kind of what me and Joe, probably a few of you too, right? So there's no shame in that. We'll talk about how to navigate that. So I'll use my case as an example as I kind of introduce myself. You know, thinking about what I do. I'm female, and I was the first Black male to graduate from my school, so they probably didn't see me coming, safe to say, but it was a welcoming experience, and I'm there. And then, you know, I went to 5 community colleges and a tech school before even going. And so grades and classes were everywhere, but I talked to people like sessions like this to figure out what's the best grade. And they encouraged me to focus on my assistant credits, to do well in the major. That's what I did, and I didn't earn scholarships by the time. And then it's extracurriculars. I didn't have a lot of resources there, but I did take a lab job because I needed money, and that ended up helping me in the end. So something I didn't know I needed ended up. Talk about, and then you want to think about your network. Yeah. Okay, sure. And then you want to think about your network. So again, I didn't have 10 people who could write me a letter, a recommendation, but I had 2 people who walk on fire for me and really were dedicated to my. We need those people to be. And resources, I don't know if you've seen the talks about his bank charging him $20 a month. That's pretty much a good reflection of my finances, so could relate to that. And that family support. So I was raised by a single mom. I moved to Arizona when I was. So the support was light, you know, but we. So why do we think about these other factors in your program? Why not just your some things to think about? I want to show you some data here where I'm looking at these categories of income, low, middle, and high. And we're also looking at standardized high school test scores and the ability of individuals to finish a 4-year degree. And you'll notice that the highest test scores and low income had just like the chance to finish a degree as those in higher incomes with low test scores. So this kind of social economic dynamic is real. And so when we talk about the holistic application process, we are looking at that whole person and understand the journey that you take from your high school years to your undergrad years. You know, so for me, my mentors kind of formed the roots of my career. I was fortunate to meet some great people who encouraged me. Dr. McGee there on the left, all the way from Rochester, Minnesota to like Flagstaff, Arizona. Recruited me to go to a school that was not on my list. And that's the school I'm going to, you know, so you just never know where these kind of life events will kind of take a turn. We talked about those extracurriculars. I had none to speak of when I came to the institution because I needed work. I ended up finding a job in a lab and then becoming a NASA fellow at the Arizona chapter. And, you know, honestly, that was life-changing. I never thought about research until that moment. And from that moment in undergrad, research life since that time. So I had no idea it was life-changing, but it was. So Dr. Lindstedt was my mentor. He was the one that hired me, and actually my first college lecture was with his wife's class, who was a speech and language. Kind of finding these things out along the way. I thought I would be a small business owner in Detroit. I ended up being a research therapist at NIH. And obviously, I'm here and not in Detroit, so I think you know how. But happy to be here with you. Talk about it. So again, you have your own story. You can make your own slide that's like this, and your challenge is to get it from your idea to a slide to paper. What way Jesus. Let's talk a bit about the program and what makes it unique. We are 75 years running as of last year. pretty well. And then we ranked 11th as of 2 days ago. And for what it's worth, it's nice to be there in the ranks. Really, it's not about what's the best program, it's what's the best program for you. What's the culture of the program? What's the affordability of it? Their academic emphasis, where you can meet your clinicals. If being close to family is important or not so important. All those things combined are going to point out to you what's not a ranking, but I think the schools in the top 25 are all well-resourced programs and excellent places. We also have this nice campus where you have all these different medical professions here, which can be. I think all these are really strengths to us. I think kind of, beyond the ranking and this and that, I think it's really our perspective. And I think what we do well is that we're a large research and one institution still has a sense of connection and community. We do have great partnerships with our clinical partners and we collaborate with them. We build community by having a closely knit alumni that reaches out to you before you graduate. And I think we demonstrate our commitment to our profession by State Board, the APTA, our pro bono clinics, and so we really do live this ethos, not talk. So what's it like being here? I won't belabor all the details in the slides, but if you look at the class attendance time, if you look at the hours, I think it's apparent to you that this job, and you can do the math if you're in class 30 hours a week. The important thing we have here are really our clinical affiliates. We're not just CU, we're CU. That includes the VA, that includes hospital, that includes children. Everybody won't do clinicals, but all those clinical instructors from those institutions, they come and help serve the programs one way or another, be it a clinical that you have, and you will be exposed to those excellent clinicians that really surround. Bioethics is kind of an interesting thing to introduce therapy, but I'll mention a couple of things. One, we've threaded in the curriculum psychosocial dimensions. Also, you do get that component as well. And in terms of the humanities, I think Robin Gisberg has also integrated that into the curriculum. That's important because I think that a reflective practitioner is a practitioner who improves your time and time again as some of the education. Now we'll talk about a completely non-controversial topic, DEI. Those are easy topics. So I think, and while talking about this, we're less concerned about the politics and more concerned about access to care and ethical approach to admitting students to. So I'm driven more by data rather than opinions, and so the data is clear in terms of people who are raised in rural communities or urban communities that are underserved, more likely to go back to their community. Talk about where there are deserts of practice, where people don't have access to a physical therapist, is in those communities. So it is something that we try to focus on in terms of our own pro bono work and thinking about the interests of students. And there are some specialties that are really hurting in certain areas, like these. We're committed to showing up that gap in Colorado and beyond. Also, and looking just at the example, Black Americans, you'll see there's no risk of overshooting the goal, having students that match. It's about 3.8% of the population in terms of graduates. And saddened to say that when you compare us to other health professions, from respiratory therapists, nurses, to physicians, physical therapy is the last in terms of therapists in the field. So there's work to be done. In terms of what we're doing, we're trying to have a holistic approach to admissions. As I mentioned, we're doing the work by being in clinics to serve and underserved, and in a variety of ways we're trying to talk about it, but really embody the values that we're speaking today. Questions about those? Endeavors, feel free to talk to me, and Dr. Malone will tell you more about some of the features we have on the program and extend beyond. Okay. Oh, sure. Of course.
Hey, everybody. How are you? So my name is Dan Malone, and I have the opportunity to talk to you a little bit, mostly about the hybrid. But before we get there, I just want to talk just a wee bit about some of the opportunities we have here as part of the CU family. So one of the things, and I'm going to just say about the hybrid, we are one program, pathways. So everything you hear reflected in what Dr. Michael Harris Love was just talking about is reflected in the hybrid pathway as well. So again, we are one program, two pathways. I feel like I have to get like a t-shirt made, with that. But so some of the service things, opportunities that we have that are opportunities with our students is we have a number of pro bono opportunities. One of the most amazing things that was student driven, and I want to bring that point home. Student driven is what's called the Dawn Clinic. And this is a multidisciplinary, interdisciplinary clinic right down the street in our Health and Wellness Center, where we serve the community of Aurora, the underserved community of Aurora. And again, I would like to just emphasize, this was a student initiative brought forward by students, manned by students, with some clinician oversight, of course, but the students are providing care to the underserved community. So this is where our students have really, put their thoughts, their beliefs into action, which I think is really remarkable. From a global health perspective, we have outreach in different communities. We used to have a global health initiative in Nicaragua, and we're continuing with that global outreach. And it's not just the physical therapy community, but the School of Medicine as a whole. So we have multiple opportunities within the volunteer service realm. From a research perspective, we are an R01 institution. That means we receive a lot of funding from the government, from federal sources, et cetera. And we have researchers that are really leading the field. And when I say the field, I'm talking from looking at rehabilitation in the ICU to optimizing recovery for those who have received a total joint replacement and everything in between. So our students certainly have an opportunity to participate in research. They have an opportunity for work study opportunities within our research labs. But one of the things, if I could just give a bit of advice, and Dr. Michael Harris Love kind of alluded to this, if you think about you're in class for 25 to 30 hours per week, that's substantial. I think we would all agree. When are you going to study? When are you going to go out for a hike? Right? You got to take care of you as well as think about your own education as well. So we do have work study opportunities, but what I would advise you to do as you're thinking about this or thinking about throwing your hat in the ring, thinking about becoming a work study student, reflect on your abilities and your time allotment and your time management skills. And do you really have the opportunity to and the bandwidth to take part in all of these different things, right? You're not a disservice to the physical therapy community if you don't go to Dawn Clinic every week. You're not. You got to take care of you. You have priorities that you have to recognize, all right? So just a few things about that. When we think about our life on campus, I think you can all say when you look around this room here, these are pretty decent facilities, right? I remember when I first started in education, we were in a building, this is back east. We were in a building that literally the pipes were exposed in the back and there were multiple trash cans capturing the water that was leaking from the pipes. So I'm really excited that we have this incredible infrastructure, not just here on the Anschutz campus, but also down at Colorado Springs. Our labs. So if you'll have a tour upstairs and you'll get to see some of our labs. So our labs can easily fit 35 to 40 students in each lab. So that means we split our labs. But we have the technology where we can simulcast from one lab to the other. So our students get the same opportunities regardless of whether in 3,400 or if they're literally just a scooch down the hallway in 3,200. Anatomy, cadavers. Not all physical therapy programs have the ability to have cadavers for students to learn anatomy. As Joe alluded to, anatomy is such a huge part of who and what a physical therapist is. Now, I have a bias. My doctorate is actually in physiology. So I would argue that physiology is more important than anatomy. But they're both, we'll fight it out. But they're both intimately, obviously, and interrelated. But we have anatomy with cadavers. And this is actually true in our hybrid pathway as well, which is going to set us a little bit apart. What's a day in the life like on the residential side? Lasts quite a bit, right? But as Joe said, and I really think this is true, I remember my undergrad experience. I'm not that old to not remember my undergrad experience, but I remember like the work that I did, and I did more studying and more work my first semester of PT school. But it was directed and it was energizing and it was exciting and it had a life of its own, and it was so cool to be a part of that. So even though it's going to be a lot of work, right? We're not kidding ourselves. It's a lot of work, but it's awesome. It's exciting work that you're going to get to do. We do have our classes on the residential side are typically broken up into 2-hour segments, right? And if you're in a 2-hour segment from 8 to 10 and another 2-hour segment from 10 to 12, you get a little bit of lunch, go outside, play volleyball, whatever. And then you're back in and you're back at it again. So again, it's a lot of work, but we do really want to emphasize the concept of work-life balance. Now, if I can say one thing, and this is an editorial about work-life balance, I don't want you to think it's like this. It's going to go like this, right? It's going to be up, it's going to be down. There are some semesters where maybe there's some coursework, you got it, not an issue. There are other semesters where the nose is on the grindstone. And it's going to take a little bit more time and effort. So the work-life balance is going to fluctuate. But one of the things you're going to hear that's absolutely supported by faculty is we want you to take care of you. If you're not taking care of yourself, how can you possibly take care of others? Right? So we do emphasize that, and we recognize that workload is going to fluctuate. We try to listen to our students. We're not deaf. We try to listen and we try to accommodate as best as we can. From a housing perspective here, this is a commuter campus, right? So there's no dorms here. So you're going to be living in the community. There is housing options in and around the community. It's pricey around here, so look into it, investigate it. You know, if this is your school of choice, start those investigations as early as you can. There is actually really great public access to the campus. And, you know, we help you set up different social media options to help connect the group amongst themselves. Cool? Does that make sense? All right. I actually spoke on things I wasn't actually supposed to.
You
but
did
oh,
well.
I ran with it. So let me talk a little bit about
Provided an important quality of physical therapy, flexibility.
flexibility. We can run. So let me tell you a little bit about myself. So I am Dan Malone. I am the director of the hybrid pathway. I have been blessed that since 2011, I have been part of the CU community. And this has been really great. So my background is actually, I'm from the East Coast. I'm from Pennsylvania. I'm from Philadelphia. So I've been told I have a little bit of an accent. I don't know if that's accurate or not. But you know, my journey wasn't quite as dramatic as Joe's and Michael's, but my journey was my journey. I absolutely kind of knew physical therapy is what I wanted to do as I entered the University of Pittsburgh as a freshman. What I think made my journey interesting was I wasn't necessarily a really good student. I was a little bit of a late bloomer. And when I applied for physical therapy programs my senior year, I didn't get in. I didn't get in anywhere. And that was a blow. And, I felt like I was wearing a big L on my forehead for the longest time because I really felt like I had failed. But it also provided an opportunity and it provided focus. And that allowed me to kind of, just rethink of what I really want. Do I really want this career or not? And the answer was yes. So I retook a whole bunch of different classes, and eventually I made myself a more ideal candidate. Now, my original part of my journey is probably similar to many of you guys. I totally saw myself in the orthopedic. I totally saw myself working with athletes and sports. I wanted to be the physical therapist for the Philadelphia Phillies. Without a shadow of a doubt, that is what my career path was. And then on my last clinical experience, I was in this neurotrauma rehabilitation center, and it rocked my world. It totally changed my interests. I wanted to work with people who were recovering from a stroke. I wanted to work with people who were recovering from traumatic brain injury. And to that end, I wanted to go work in acute care to see the acute care management of acute brain injury. I thought it was going to be a 3-year plan. 22 years later, I was still there. I became an acute care guy, which was really unique, and I got to work in the ICU. I was very blessed. I was on the front lines of rehabilitation in the ICU. So when Joe talks about movement and functional recovery, think about how broad that is. That can be helping a pitcher get back to throwing a 95 mile per hour slider. Or in my case, it was helping someone being able to sit at the edge of the bed by themselves while attached to life supportive equipment. And everything in between is function and movement. And that's what's so awesome about our profession, is we get to help these folks recover their function. So I was very much in acute care, very much in ICU. I'm still a ridiculous Philadelphia sports fan. One of the favorite questions I have is, what is a MET? And everyone's like, oh, it's it's a measure of oxidative consumption. No, a MET is a lousy baseball team. We all understand that, right? So your journey is your own. Now, what is unique about the hybrid? So again, one program, 2 pathways. Our students, we value if they stay in their home community, right? Right now, I know with our hybrid pathway, we have about 1/3 of our students are out of state. That's awesome. That's exactly part of the reason this hybrid pathway was developed. If you live out of state, if you live in Oregon, I remember we interviewed this candidate from Oregon, and she's a mom with 2 kids. Picking up her life and moving to Colorado, not a good option. But the hybrid pathway, what a cool opportunity for that person. So living in your home communities, whether it's out of state, or maybe it's on the western slope, or maybe you're on the eastern plain, whatever it is, living in your home community is a wonderful opportunity. We are one program, 2 pathways. We have a 75-year history of physical therapist education. This ain't our first rodeo. I think what we do well. The infrastructure here, you're going to see, is absolutely lovely and fantastic. And having said that, oh my goodness, what we have available down at Colorado Springs is more lovely. I shouldn't say it like that. It's absolutely fabulous. We are blessed with an abundance of riches. Now, the building is a building, right? A building is a building. It's cool, it's shiny, it's bright, it's lovely. The people. We have shared resources of people across both, which I think is really kind of cool. Now, what is our hybrid program going to look like? No more than 40 students. We're purposely capping it manageability. all classes, when you think of what you typically did in undergrad. Now, I know that that's a weird thing to say as we exited the pandemic, but think about everything you do in the lecture hall, that's now in the virtual space, right? How many of you guys have been in a virtual classroom? I would imagine almost everybody, right? So this is not new to you. Imagine in a couple years, as we keep going through a couple admission cycles, the number of hands that when I ask the question about a virtual classroom is probably going to start decreasing as we kind of reflexively go back to the old way of education. So the virtual classroom. Within the curriculum, not only do we have classes in the virtual classroom, but we have live classroom activities in the virtual space, synchronous activities, but then we also have immersion labs, which I'll talk about in a second. So this is kind of big picture, 30,000-foot view, what a hybrid pathway looks like. So much of the lecture didactic material is in the asynchronous space. Modules that have been put together, we're working specifically with instructional designers, right? A module should not be an hour-and-a-half lecture. Oh my God, that would put me to sleep. But a module should be 8 to 10 minutes of really important didactic material with some kind of learning activity at the end. And then you can step away if you need to clear your mind for a second. And then you can come back to it when you're ready. Our labs, some of the labs will happen remotely, right? We're saying we want about 20 to 25% of our lab activities to happen in the virtual space. But the vast majority of it is going to happen during our immersion times down at the Springs. And as Joe has already alluded to, our clinical ed opportunities, right? When I think of our clinical education curriculum, it's best summed by early and often. We do it early, we do it frequently. That is what we have looked at. This is what a sample week can look like. I want you to, if for those of you who are interested in the hybrid pathway, I want you to consider the fact that you do have a live session, a class, every day. Right? As you've heard a couple times already, this is a full-time curriculum. The curriculum across both pathways is the same. The courses are the same. The sequence of the courses are the same. The credit load is the same. The amount of clinical education, the same. I think you get the idea. It's one program with two pathways, right? So we have weekly live expectations where the student will join their faculty in a Zoom room. And this is a time to really work on integration of the material you have already reviewed independently. Big picture, this is what our summer semester looks like. You can see it's an 11-week semester. At week 6, we're going to have a week-long immersion. That's when students would come to Colorado Springs, and pretty much Sunday to Saturday, you are engaged in the laboratory with faculty to review, to practice, to perfect the psychomotor skills that you've been learning week 1 through 5. Does that make sense? And then you go back to your home communities, wherever that is, starting week 7 through 10. And then you come back to Colorado Springs and join us again for another week-long immersion where you get to perfect those skills that you've been working on for the last 4 or 5 weeks. Does that make sense? Yeah, cool. So it's a little different than the residential pathway, where labs are interspersed. You know, for example, you might have your musculoskeletal lab from 8 to 12 on Tuesdays and Thursdays, right? But we're not skimping on lab. The lab time during the immersions, same. They're just grouped together and scheduled a little bit different. With the hybrid program, obviously, it's hybrid, right? We want you to live in your home communities. There are dorms down at Colorado Springs, which is different than here, but that's an undergrad campus, and you're in graduate school. So a little bit different. The program will not be making travel arrangements for you if you live out of state or if you have to drive or whatever. You know, that's what you will do. Now, we can assist a little bit with that, where we're gonna talk to regional hotels and things like that. But I'll be honest with you, when I talk to some of our colleagues who have hybrid programs in other states, students might access a hotel room for the first immersion, then after that, forget it. It's Airbnb and VRBO all the way. So again, makes sense. It's more cost effective. It's a nice way of, you know, interacting with each other, et cetera. So that's kind of an overview of the hybrid. If there are additional questions, I'll be happy to take that at the end, but I'm going to stop here and I'm going to turn the mic over to Laura. Thank you, guys.
Excellent demonstration of flexibility. Okay. All right, so welcome everyone. I am going to spend the rest of our time together talking a little bit about the application and admissions process. And so now that you've heard that we are one program, two pathways, I'll be the first to say we are one application. Great, right? This gives you a little bit of flexibility to potentially modify what your interests are and learn a lot about the program, see what really fits you, and decide that upon application. So first, let me tell you a little bit about myself. My route is not quite as crazy. Thank you for the word. It actually involves being born and raised here in Colorado. I went to my undergrad at University of Notre Dame. That was my one diversion. Then I came right back to Colorado and I attended this program for my PT education. Graduate from the class of 2011. And I did start working in sports medicine and outpatient orthopedics right away and learned pretty quickly, taking some students to CI, that I actually really enjoyed the teaching. So I emailed some of my favorite professors and said, do you have any need for help in any of your classes? And sure enough, started becoming a lab instructor, got my foot in the door, and I became a core faculty member in 2015. Not looked back. So I do still practice. I spend about half my time both here teaching as well as in the clinical space, still in outpatient sports medicine. In the last about 7 years or so, I've really subspecialized in the treatment of runners. Here in the Denver metro area, there are a lot of them. So I really enjoy that. It's a fun population. One of the courses I teach here in this program is I coordinate the movement science lab. I really get to dive into all the biomechanics principles when I work with runners and look at running form and really dive deep. So that's been really fun for me. And one of my passions here on the faculty, one of many, is the admissions committee. So ever since joining the faculty, I was an admissions advisor. I started working and talking to prospective students. I've always loved that role, and admissions is a soft place in my heart. So I'm part of the admissions team. When you communicate, you have 3 admissions advisors and myself. We all man the email box. We participate in these events together. We collaborate on a lot of activities. So when you talk to the admissions team, you're talking to a fantastic team of 4 that we've really built up over the years. So as I dive into some of the requirements, I want to be the first to say a lot of this is online. So go to our website. If you're not quite sure, if I rush past a prerequisite, whatnot, it's all on our website. And the second thing I want to say is we are here to help you. This is not meant to be a scary or like a process that you're guessing, right? We are here to help you. We are going to give you the email address. We will say, if you have any questions, reach out. Am I taking the right prereqs? Does this professor count towards my letter of recommendation? Is this the right course sequence? Am I ready to apply in 2 years or do I need to wait 3? Email us. We are here to help you through this process. This is not meant to be scary. And even if you don't end up coming to the University of Colorado, we are here to talk you through your journey, what you want to do with your future. As we dive in, Joe mentioned a little bit that, you first have to graduate from an undergraduate program. I want to be the first to say, though, that your bachelor's degree can be in any field. A lot of people say, oh, I have to be biology or I have to be exercise science. No, we want you to major in what's interesting to you. That also means that you need to complete all of our prerequisite coursework. So if you're an English major, for example, great. But don't forget to take the prerequisites as part of your electives and what you need to complete for graduation. We do require a minimum GPA of a 3.0, and this is based on all previous course attempts. And I'm very keen to say this because a lot of institutions do what we call a repeat delete. Whereas if you take a course, maybe you got a C in it, and you retake it for an A, that institution will wipe out the C. They'll give you the higher grade. But in the physical therapy space, in our centralized application, they take both grades. So it effectively averages. So this might affect your GPA. So if you're someone that's taken or retaken multiple courses, do the due diligence of calculating what your GPA is, figuring out, is it above this 3.0? All previous course attempts. This includes even sort of dual degree coursework you might have done. Maybe in high school, maybe you took some courses in a community college or whatnot to fulfill credit. We would need all of those transcripts and all of that. If you're a foreign language or excuse me, or an international student that has a foreign language, we do require the TOEFL or the IELTS is the name of that. And if you attended, however, a US institution for your grad, then we would not necessarily require those tests. And then as mentioned, I think by multiple, as you're shopping around, looking at the admissions requirements. Some programs do require the GRE, some don't. We are one program that has decided to eliminate our requirement. So for the last few years, we have not required the GRE. And in fact, even if you take it and you submit your score to us, we aren't going to look at it. It's not the way that we are going to compare our applicants. So I mentioned the 3.0 minimum, but I want to be very clear about some details. The average cumulative GPA in class is quite a bit higher. We see about a 3.6 for the cumulative. We see about a 3.4 to 3.5 for the science GPA. And so it is competitive. We also consider the last 60, I mentioned the science GPA is in terms of all three of those as we look at the big picture. For the science GPA, we do not require a minimum, nor for the last 60 GPA, but we will be the first to say that below a 3.0 are not as competitive. Now, if you're somebody who has a 2.7 to technically a 2.99 of your cumulative GPA, we will consider you if you also have a positive grade trend, which means a 3.5 in your last 60 credits, and strong grades in some of our key prerequisite courses. We understand that things happen, right? Maybe you changed majors and because of that, maybe the initial courses that you took your freshman, sophomore year, you didn't maybe do as well. Maybe there was an illness or death in the family. Things happen, grades happen, right? We look for those trend of grades. So if your cumulative GPA is low, but you've really shown us, look, I got on track, my grades improved, I have greater than the 3.5 in my last 360, we will look at you if you are between that 2.7 and 2.99. So I just want to be clear again, if you're not quite sure where you fit, email us. We will help you with these calculations. We'll get you on track. How many courses do I need to take to get to this point where I can have my application reviewed? So again, these are on the website. I'm not going to spend too much time here. Most of these are pretty standard for PT programs across the country. Again, check the programs you're looking at because there might be slight variations. So we require a course in English or writing intensive course in statistics, general chemistry, both 1 and 2 at the lab, so a full year sequence of chemistry. Same for physics, full year sequence of physics with labs. 2 psychology courses. We recommend abnormal psychology or developmental psychology. However, if you've taken like a general psych in order to get into one of those, many times you have to have a prerequisite to get into those courses. We would take that as your first of the 2 as well. We would take any psychology. So if you took sports psychology, other family behavioral psychology, we would take those. And then we do require anatomy and physiology, both separate courses if you're available to take them separately with labs, or sometimes they're combined like A&P1 with labs. And then on the next slide, I'll describe a little bit in more detail. I will say if you're someone that attends a quarter-based institution, these semester hours, that's what we have up here, don't quite match. Again, email us, we'll help make sure you understand where your quarter hour and semester hours fit. So this final requirement, we require an upper division science course, biomechanics, or an exercise physiology class. So when we say upper division science, what we mean by that is a 300 or 3000 level or above in the chemistry, biology, or physics departments, or even engineering. So if you are taking, for example, maybe it's a biochemistry class or a cell biology class, as long as they're labeled 300 or 3000 above, or your institution has a different numbering system, designates it as an upper division, we would count that to meet this requirement. We also understand, many of you, again, might be taking exercise science, exercise physiology as your majors, and you have the opportunity to take exercise physiology or biomechanics. We would accept those to meet this requirement as well. And we will accept the lower division of these because many institutions offer it at the lower division. Maybe that's the only course they have. There's some community colleges that offer these topics. We will say though, the opportunity or you seeking an upper division in these courses shows more competitive and more competitive applicant. You'll have a stronger background, but again, we would accept the lower division. This is a little bit of a busy slide, so hang with me. There's just a few key details. So the first one is about timelines. For anatomy, physiology, and that final requirement, that upper division science, or exercise physiology, biomechanics, those must be completed within the last 10 years, preferably the last 5, so that the knowledge is more fresh in your mind. We want you to come in prepared. You don't have to dig deep into your memory bank of where was that bone and what did it attach to? And so preferably the last 5 years, but a 10-year timestamp. Now that relates to what year you apply. So every year that passes by, that 10 years moves right up with it. So again, email us if you're worried at all about your requirements passing this timeline. We will help you sort of determine, are you in that window by the time that you are set to apply and matriculate? Because many of our students and the timeline of the application are applying in the fall, but many of them are still taking courses in the fall and even in the spring prior to starting school. That's totally fine. But what we want to let you know is that because we want to see as many of the grades in your sciences upon your application, our program only allows you to have one outstanding science prerequisite in that spring prior to matriculation. If you're applying to this year, for example, or this coming cycle, maybe you have courses in the fall, maybe you have courses in the spring, that's fine. You could start next summer. Let's say in the spring, you need both your anatomy and your upper division science. Unfortunately, you would need to wait. We only can allow one of those sciences in the spring prior to graduating. Now, let's say you had anatomy, but you had your statistics, fine. Maybe you had your psychology, fine. You can have any number of those other courses in progress in the spring, but only one science so that we can have your science grades as we are determining through our admissions process. So again, when you apply in the fall, the deadline is October 1st. We'll get your application, we'll go through our process. That's even before your fall grades are due. That's something else to consider. If you have a really heavy fall course load, we won't even have your grades upon our first pass to invite you to interview. So really be careful, have your grades really strong leading up to that, and be careful about the timing of when your courses fall. So again, if some of you I see kind of like, ooh, uh-oh, okay, does this mean we wait a year so that you have everything ready to go by the time you hit submit? This is where we're here to help you talk through some of these questions. You have a grade that is a C- or below in a course of our prerequisites that must be retaken. We will accept those courses. Now this one's a little tricky. So if you took a lower division anatomy and physiology, maybe your institution offered that, and you took an upper division anatomy or physiology, that can count towards that upper division requirement. But if you took lower division A and P and then just retook it because maybe you wanted a better grade, that will not count, right? It will only count towards that upper division if you took the full lower division sequence and then took the opportunity. Some institutions have sort of an advanced anatomy or advanced cadaver dissection. Some of those titles that would count towards your upper division science. Then for those of you that took an AP or IB course in high school, we would accept those as credits. We prefer if your institution that you attended lists it on your transcript. So it will say 3 credits received for writing, 3 credits received for statistics, for example, if you took AP. If your transcript does not show that and outline it for us, we would need you to have proof of your tests through the College Board, I believe is who it would be, and send that to us for verification. We will count those credits. All right, in terms of other requirements, many programs require observation hours. And a few years ago, I was part of a task force that said we really need to be transparent about how we use these. Do we require them? Do we recommend them? What do they do? How do you use them? Do you get more points on an application if you have 100 or have 1,000? So what we do is we do consider them, but we don't require them. And what I mean by that is we expect that as you come to our application process through your essays, through your interviews, that you're ready to talk about why you want to be a PT. And we expect that you have traveled through a journey of learning if that's the right career for you. And that could include observing and shadowing, but it could also include maybe you listen to some podcasts. Maybe you shadow other healthcare providers and you realize, you know, those other ones didn't really fit for me. But when I saw a PT or I talked to a PT, that's when it clicked. I want to do that. Maybe you talk to therapists on the phone about what does the day in the life look like? Maybe, so we call this sort of informational interview. Maybe you utilize the American Physical Therapy website and look, they've got a whole section about prospective students and what it is to be a PT. Do that. So we don't require a specific number of hours. To us, there's not a magic number. Some people could go and observe for 10 hours and have the most enriching experience ever. And others could be a tech for a year and all they do is wipe down tables and they didn't really learn what it's like to be a PT or talk to them about what it took to become a PT. So we aren't the ones to judge what that experience is and what those hours, what the quality of those hours are. And so therefore we don't require them. But again, in your essays, and should you be invited to an interview, we really expect you to tell us, this is why I want to be a PT and these are the steps I took to learn about the profession and why I'm here today wanting to do this. Letters of recommendation. So we do require 2 letters of recommendation, and that is from individuals who know you well. The system has a max of 3. So we often get questions of, how many? I wanted to send them all in. So minimum of 2, maximum of 3. We would accept anyone with the exception of family, friends, and clergy. And so really we're looking for people who can speak to your experiences. The most common ones are licensed PTs who maybe you can observe or spend some time with, or some of your professors. And then also those who have been employed, maybe your supervisors, maybe if you're in a research lab, it's your sort of the primary investigator of the lab. So maybe it's a coach of a team that you are part of. Maybe it's your advisor in your undergraduate program. We want them to be able to speak well on your behalf. And do know that because we have these 2 requirements, that your application actually doesn't move through until those 2 letters come in. We actually won't even get them if your application, unless your letters are passed by. So it's in your best interest to ask your references early. Tell them, here's my deadline, but I want to be sure to send early, maybe mid-September, right? If our deadline's October 1st, maybe you ask them for a deadline and planning ahead, making sure you can keep track. In the portal, in the PTCast portal, and I'll talk a little bit more about PTCast, you have the opportunity to sort of watch the pathway of your application as it passes through. You can see that your transcripts are coming in, they're verified. You see your letters come in, you see where it's like, if there's some problem, you can identify that. We encourage you to really pay attention versus hit submit, hope you're done, and then whoops, that transcript your application never even got to any programs. Make sure you're checking on that. As far as additional requirements, I've mentioned a few times essays. We do require a few essays as part of our application. This is on PTCast though. So within PTCast, you click Colorado, you fill out the application, it takes you right there. It's not like you need to go to some external website. You're not applying to our graduate school here at Anschutz. You're applying on PTCast. We do require a supplemental fee of $50. This allows our large team of reviewers who spend a significant amount of time reading. Each of your application, I'm gonna guess, is viewed minimum of 45 minutes to an hour. And that's by multiple people who read every line of your transcript, every line of your essay, everything that you've included is read and taken into consideration. And so because we value this team, we have the fee to help pay for those resources. That is a website that is linked directly through PTCast. So we'll have a question that sort of reminds you at the end, did you pay your fee? Here's the link to do so. It's a link for our program here. And this is in addition to PTCast. So PTCast has a separate fee. I'll dive into that a little bit here too. And then we do require interviews. I've mentioned that a few times. This is by invitation only. So you'll hit submit in October. You'll have sort of a waiting period while we review all the applications. And in December, we will send out whether or not you've been invited to an interview. If you're invited, it is a Zoom interview. It's a virtual interview. You get to pick your time slots over a 3-day period, and you'll pick 2 slots. You're gonna have 2 interviews, each of them being one-on-one with one of our faculty or some of our partners that are affiliated with the program. So about 25 minutes, enough time for us to get to know you, as well as you get to ask questions of us. So the interview is just as much about you interviewing us as we are interviewing you. We want to make sure that this is really good partnership moving forward. So again, I mentioned that it's virtual, and that really allows for individuals. Maybe you have a work schedule, maybe you have children, maybe you don't live here and you can't travel to Colorado to come interview. We want to make it as possible, so we have a virtual interview experience. As I mentioned, a lot of this is on the website. Please check here for any changes, updates, clarifications. We make sure to update anything that happens that we make decisions upon in a timely manner. So we brought up a little bit in the past talking about our holistic review, and I want to dive a little bit deeper to, again, if we're looking at all of you far more than just your grade. I mentioned GPA, yes, it's important. We want you to succeed in school, and therefore having a good history of being a strong student and strong academics is key. However, we also really value that our applicants can bring in a lot of diverse experiences, backgrounds. We want to learn about you. We want to be able to bring you in some of the really experiences and attributes that you have. So I've mentioned before, we do look at that rigor of courses and that positive gradient. We look to see that as you've taken more of the prerequisites that are sort of more in line with the physical therapy, like anatomy, physiology, that you're excelling. You're loving this content. You're excited about it. We see that growth. Our program is also really committed to serving our community. Talked a lot about the Dawn Clinic and some other service opportunities, advocating for patients. That's both here locally in Aurora, Colorado Springs, even globally. And so we look for students who maybe have a track record of having some sort of service-oriented goals, or maybe being involved in a variety of ways that they help their community. We also really value the idea of leadership and being proactive, being flexible when you're thrown something you're not necessarily prepared for. So we're looking, do you have leadership experience? Were you maybe a supervisor in a job position? Did you have a president or vice president position in a club in your undergrad? Did you plan a large event? That alone is leadership, right? Being able to navigate and organize something and launch an event. So tell us about the things that maybe show leadership in your background. We have just under 1,300 applicants for about, if we count both cohorts together, about 110 students. The best way to get to know you all individually is through, again, we read every word. But we in the essays are looking for a lot of reflection, again, on who you are, what your life experiences are, what have brought you to the profession of physical therapy. And that's the best way for you to show how you're unique. And everyone's going to have the same prerequisites. We're looking for, people with strong grades. Where can you stand out? It's these essays. This is where you can look different from those that are applying as well. I mentioned the clinical observation. Again, we're looking for your experiences, your reflection on, okay, I saw this and I was inspired. This is a role model type of PT that I want to be like when I'm a PT? Or maybe you saw something that didn't go so well, or maybe you were a patient and you're like, I didn't quite love PT and I want to change. I want to be part of what improving this profession. Like, we want to know that. And then we talked a little bit about the recommendation letters. I've mentioned multiple times now this PT-CAS. This stands for the Clinical Therapist Centralized Application Service. It is where almost all of the programs across the country utilize this service. I'm 99%. The essays and such will be within the application. Again, you will be applying to University of Colorado. Whether or not you're looking hybrid or residential, you're applying to the University of Colorado. And then within the application and throughout the interview and other process, we will continue to ask you, which pathway are you most interested in? We'll help funnel you towards where you end up wanting to really be and seeing yourself as a student. So last year there was a fee to apply of 165. I do believe that has not changed, and that means apply to one program. If you want to apply to more than one program, then each additional program is $60. So consider this from a financial standpoint. You know, you kind of thought, oh, I thought I'd apply to 20, just kind of hoping that, you know, throw a dart and something will stick. That could be a significant financial burden. It could be that 165 plus 19 times 60, something to consider. Now, for all of the programs, everything goes directly to PT-CAS. So you are not sending us any of your transcripts. You're not sending us any of your letters of recommendation. This is all going directly through PT-CAS. So nothing goes to the programs themselves. We just say, send it to PT-CAS. This is where everything is housed together. As far as our timeline goes, the application opens in the middle of June. This year it'll be June 17th. We have a deadline of October 1st. Every program chooses their deadline. Most of them are in the fall sometime, but it could be October 1st, could be November 1st. So again, keeping track of all the different requirements of the programs that you're looking at. Ours is due October 1st, submitted by 11:59 Eastern Standard Time. Every year we have people who miss the time change and are maybe an hour or two off. 11:59 Eastern Standard Time, so be sure to submit. And that is completing your application. You hit submit. Now, and this includes, before I move on, this does include that supplemental fee payment and your letters of recommendation. You're hoping that they're in so that everything can move through. But PT-CAS takes a while on the back end to verify everything. You imagine you hit submit at 11:58 Eastern Standard Time, and then PT-CAS needs to go in, verify your transcripts, make sure your letters are there. Make sure that all of your components are, they've got the details that they want. This could take 4 to 6 weeks. Now we're encroaching upon the programs, not just ours, timeline to be able to read all the applications, sit for decisions, turn around and offer you interviews. So we have a deadline ourselves of November 8th that your application needs to be verified by that date. And if it's not verified by then, unfortunately, we can't review it. We have all these 1,300 applications to review. We have set meeting times. We really have to sort of set a deadline and say, past this, we won't be able to read these applications. But again, you hit submit October 1st. Don't just sit back and say, all right, done. Make sure you go back to PT-CAS, make sure that you have your transcripts, moving through, that you see that your pathway is progressing forward. You'll get an email from us saying your application has been received in a review. Then you know we have it. You're like, oh, all right. I think everything has passed smoothly. But if you don't get an email from us saying that, something is caught up. So be sure before this November 8th to check and make sure that everything is passed through. We plan to have our interviews on January 14th, 15th, and 16th. So again, in early December is when we'll plan to meet. We'll decide who to invite to interview, and you'll get an invitation. Usually those letters are sent out by mid-December. So you have a month to prepare for your interviews. And then we do have an optional campus visit. So we have a visit both here, similar to today, where you learn about the program, have a tour, you get to meet current students, mingling. It's a wonderful opportunity. And we'll also have a similar day down at UCCS for those of you that want to come to Colorado Springs, see the Hibble Center, meet some faculty, meet some students. We'll have 2 separate days, January 17th, January 18th for those campus days, should you want to. And then optional, we make sure that your attendance does not earn you brownie points on your application. This is just for you, again, to interview us and see, can I see myself attending CUPT? So this is really for you to come see campus. Again, we're not going to keep track of who attends and give extra points on your application for your admission decision. And then in late January, after those interviews, sort of through the spring is when we send offers. So as you imagine, we send an initial wave. Then we have a large wait list so that as people maybe say no, or maybe they originally say yes and change their mind, we move through the wait list. And so this is really through the spring. And to be quite frank, we could offer acceptance really up until orientation. If someone is willing to come. So in April, we say we kind of try and finalize that class, but really by May and our orientations, we have the opportunity if we really need to offer more spots. So tentatively for 2025, the class of 2026, I suppose, yes, 2027, we would be starting orientation May 28th through the 30th, and then classes would start that first Monday in. So I mentioned the 6-week verification. And this slide is all about, please be mindful of those dates, checking your PT CAS. We don't do any rolling or early decision because of our holistic review. We really believe that we need to look at everyone all together, the entire applicant pool. And so we have one sort of date rather than a rolling or early decision. Here's some numbers from the last 3 cycles to give you a sense. I mentioned sort of around that 1,300 for the last 2 years. You can see this year we interviewed quite a few more. We invited to interview and interviewed because the hybrid pathway is our first cohort. It just went through this admission cycle and is starting in June. And so instead of matriculating our 70-ish students for the residential pathway, we are matriculating both now the residential and hybrid. So we're interviewing a lot more people because we now have additional fees. So we have, every year we're shooting for, again, around 70 to 74 for hybrid, excuse me, for residential, and around 35 to 40 for the. As for what the demographics have looked like over the last 5 years, this is available on our website. There's a specific page, the statistics and demographics, where we try and show you that generally the breakdown in terms of things like out of state, in state, those from our rural communities. You can see some of these numbers that they've been flowing. And a lot of that reflects our applicant pool. So it doesn't tell a full story if you just look here and you say, oh, what happened in 2023 where those rural numbers dropped? Well, maybe we didn't have as many apply, right? So we can only really work with what our application pool looks like and then really working through this holistic review process so that we can take a larger look at what our cohort can end up with. This is our class of 2026. So again, these are our students starting in June. You'll see the same demographic layout side by side. So largely in terms of gender, we have somewhat similar. Colorado residents, you can see in our hybrid pathway, a huge swing towards Colorado residents. And a lot of those, again, potentially choosing to live outside of the Denver metro area, the Colorado Springs area. They maybe are on the western slope, like Dan mentioned. Maybe they're down in Pueblo, maybe they're in the eastern. We do see in our hybrid pathway more Coloradans. And we also saw a huge jump in terms of our underrepresented minorities, about half of the cohort. And then the others, in terms of first generation rural, are pretty similar to about 20 to 25% of the cohort. And one of our missions with the hybrid was to see sort of this connection of Colorado Springs, the Air Force Academy, some of the military background. You see that reflected here. We have a larger percentage of our hybrid cohort with military experience. The GPAs, though, very much similar. So again, as you're thinking about, oh, it's one easier to get into because the grades are different. No, not really, right? Where we see pretty similar. All right, so for these last few minutes, I just want to talk to you about something really important. And that's tuition, finances, thinking ahead. I really want you to be educated consumers of what it is that you're looking at when you're thinking about PT programs and the PT profession. We talked a little bit about the cost of the application. Maybe if you have, maybe you're applying to a program that requires you to come to an interview, maybe travel for that interview. Maybe you don't live in the state of the program that you're going to go to and you need to relocate. What does it cost to relocate? What are the living expenses? So if you choose to come to here and live in the Denver metro area, what's the cost of living in Denver compared to maybe where you are? Those of you that are joining us on Zoom, or maybe it's very different from where you're coming from. And then as you're shopping these different schools, thinking about public versus private, in-state versus out of state, can I establish residency? So really important things as you look at all the programs that you're applying to. Colorado is really special in that we allow our students to establish residency. So if you live in Colorado for a year, you become eligible for in-state tuition. It's huge. Not a lot of programs do that. So if you're out of state, you're required to pay out of state the entire time. Whereas here, you could be eligible after 1 year of tuition. The requirements that you need to become a resident, usually 4 things. Have a permanent address in the state of Colorado. Register your vehicle if you have one. Get a Colorado license plate, or excuse me, a Colorado driver's license. And register to vote. Those 4 things, the date that you accomplish those 4 things, showing that you're a resident, our Office of Residency will then say, you're from the state, you are eligible for in-state tuition. So this is all on our website, no surprises here, but I'll lay out for you. The cost of our tuition is by semester, or excuse me, by credit. So each semester is broken down on our website. I've calculated the total tuition cost. So this does not include fees. This is just our total 116 credits. And this is utilizing, I believe I chose the spring of 2024, this 610 per credit hour for in-state. You can see that calculates up to about 72,000. Out of state, if you were paid out of state for the first year, but established residency for the remainder of the curriculum, you can see here that that's just under 104. And then if you were a part of the hybrid pathway and you chose to live out of state the entire duration, you're looking at 152. And then these are subject to change. We do not determine the tuition. This is something that the Board of Regents decide in the state. So do know that this could change, but these are anticipated for the next several semesters. Now, this slide is a little bit old, so do note that the numbers you see here might not directly reflect what you just saw. However, the messaging stands true, so I felt it was really important to still include this slide. And the message is, these are the top 20 programs in our country. And what we did was we pulled the in-state tuition costs and fees of the top 20 programs, which we're really proud. We just moved up from ranked number 13 to number 11. This news just came out last week. So the top 20 programs in the country ranked by in-state tuition cost, including fees. You'll notice that not only are we a top ranked program, we are really of a high value, right? We're one of the most affordable programs when we think of in-state tuition. If we look at out-of-state tuition, and again, this is if you establish residency after that first year, we still fall in one of the more affordable programs of these top 20. So not only are you getting an excellent education, high quality institution, but we're trying our best to keep our tuition numbers low. And we don't quite have the same schematic for the hybrid pathway, but I can tell you just anecdotally that we fall right in the middle of what we see from other hybrid programs. And again, their cost structure differs a little bit. Ours models what our residential pathway does by having this in-state and out-of-state. Not every hybrid program has that. So just be aware as you're looking at different programs. As far as scholarships, we are so proud that just in the last 13 years, we've gone from offering $1,000 in 2011 to in 2023, we offered over $260,000 in scholarship, and that number continues to grow. Those opportunities are available both for residential as well as our hybrid pathways. And we have both what we call prospective student scholarships as well as current. So prospective being those of you applying, you would have the opportunity to apply for scholarship around when you're offered the interview. You would submit your application for scholarship. And should you be offered a spot in the class, we would tell you then and there, congrats, you're in, and guess what? You've been selected for a scholarship. And then once you're in the program, you'd have the opportunity to apply again as potentially like a second. And to align with our program missions and values, we do have a focus of our scholarships on diversity and our communities. And I want you to know our definitions are very broad. The definition in diversity, if you look at the School of Medicine, that is large encompassing. We really are what you do bring to our program is different. Can really help our classroom cohort as well as its graduating. As far as the job outlook and what to think about in salary as a PT, so the Bureau of Labor Statistics estimated that the PT field can grow 15% between 2022 and 2032. And the average growth for most occupations is around 8%. This is huge. Things are looking really bright for physical therapy. We're going to see a ton of more job openings. We have a natural attrition. A lot of PTs are in the age where they're going to start retiring in the next few years. Also, just the aging population in general, there's more chronic conditions, there's more opportunities to treat patients as PTs, and more people are becoming just aware of what PT is. They're accessing PT more, knowing, hey, maybe I need that. So there's a lot of good reasons that we're seeing growth in our profession. In terms of, with that being said, the bullet on the bottom, we need to consider geography, we need to consider practice setting, because that's where we see difference. So let me show you what I mean by that. So here's a map. If we look at the annual wage or salary of PTs, now this is as of 2021, this is the data by state, you'll see that there's a discrepancy. You know, maybe in some states, like in the New England area, California, Washington, much higher wages. Guess what? The cost of living is also quite a bit higher in some of those places. Whereas you look at some of the places where maybe the mean wage is lower, but maybe the cost of living is way more affordable. So we can't forget that when we're looking at this picture and say, oh, I'm going to move to Connecticut. Well, let's think about that a little bit when you know. In terms of setting, also data from 2021, you'll see that depending on the setting that you're working in, the opportunities for salary do differ. For example, if we look at the very top line of our private outpatient office compared to down the road, here's a skilled nursing facility, that's about a $15,000 difference. And a lot of that is various reasons, the reimbursement rates from insurance companies, opportunities, number of patients seen, number of providers. There's a lot of different reasons for these salary differences, but do note that your geography, setting location, and your years of experience largely dictate what your salary. So if you just Google how much do PTs make, take it with a grain of salt and really dig a little bit deeper. Especially if you're like Dan and you're like, I am going to be a PT for a professional sports team. That's probably going to look a little bit different than again if you were. So when you think about financial strain, or when we think about it from a program side, we know that those who are worried about their finances have higher levels of stress. It might affect your life choices, some of your choices, maybe where you we really just remind you to think about those big questions now. So understanding now, where does your money go? When you start school, what might change? You need to budget. If you need to take out loans, what might change? How can I plan for this? Maybe in the next, several months, track and see where your money goes. See, right, if I were to stop this job that I have to go to school full time, how can I manage this? How can I navigate this? When you think about taking out your loans, understanding the details about it. There's a lot of good resources out there, not just in physical therapy, but sort of understanding what kind of debt am I taking out? What does this even mean? What is compounding interest? What is, if I'm given a package of X amount, do I take the full amount, or how do I navigate this? These are all questions we really encourage you to ask so that you don't get to graduation day and go, oh gosh, I didn't prepare for some of these. Educating yourself. So we have a lot of studies, not only in the PT realm, but elsewhere, that shows that the sort of just getting yourself a little bit more prepared by even listening to me today, reading a book, attending little YouTube videos about finances, that this shows self efficacy and positive financial behaviors. And then just the idea of sort of developing a plan, developing a fund, and being sort of thinking ahead to if you incur some debt. So I mentioned there's a lot of resources. Our American Physical Therapy Association has a financial solutions center that you can access as a prospective student. By far, the best resource I've seen is this financial aid FAQ sheet for prospective students. You just Google that, it'll take you to this ACAT. This is our academic Academy of Physical Therapy, phenomenal resource talking about a lot of these financial questions. And then if you really are serious about CU, our financial aid office will talk to prospective students. You don't have to be a student here to access some of their advice and resources. If you really believe, I think I'm gonna go to CU someday, I wanna learn some more. On our website, we also have what we call a financial fact sheet that really details down to every semester, the costs, the fees, adding up, other, maybe a ClinEd cost that didn't not mention this slide. It details all of this. It's available on our website. We have separate for the residential, for the hybrid pathway. So do your due diligence and think about some of the financial components now as you're looking at different programs. Our website is full of good information. So if we didn't tackle it all today, go look at the FAQ page. There's student videos. There's some phenomenal videos on our main, just click the DPT education page. Some students during COVID interviewed each other. And so we have a recording. They're about 5 minutes each. One's about kind of work-life balance, school life balance. One's about getting into PT school as a non-traditional student. One's about sort of success as students. So go watch these videos. They're phenomenal. And then this is this email address that carrot I've been dangling ahead of you this whole time. Questions, please email pt.admissions@cuanschutz.edu. No matter if it's the residential pathway or the hybrid pathway, all your questions come to the same email address. Our admissions committee, our recruitment committee is an umbrella over both of these pathways. And so we're here to help you navigate against this decision. So we first will answer questions, but I'm excited that you'll meet some of our students. We'll have a tour of our facilities here. But with the about 10 minutes that we have, I'm going to pause and invite some of our speakers back up and see what questions that you all have for us before you embark on your tours. Questions, or Natalie, if there's been any in the chat, maybe you'll let us know. We'll repeat the question for those on Zoom. Yes.
I just had a question regarding prereqs. So if you're taking, fall classes in spring and applying in the fall, but you don't have those grades, is there a way to get those, like after application, get those to you so you have that information, even though it's
For the
post?
participants on Zoom, I'll make sure I have your question correct by restating it. The question is, if you have courses in the fall and especially in the spring, how do you get those grades to us so that we know what's happening? So in the fall, there's an academic update period right at the middle of December through the middle of January, where you can log into PT Pass and update all of your fall courses. We see that then live, it's automatically given to us. So, and it shows the little A view that says completed academic update. So we would get your fall courses there. For your spring courses, at that point, we would have already offered an invitation to accept spot in our cohort. And so at that point, we would need a final transcript. You would need to complete all your prereqs. You would need to get that C or better in any remaining prerequisite courses. We would need that final transcript before you start.
And
Oh, yes. So if you have spring courses that are prerequisites remaining, you require proof of enrollment.
Mhm.
And when we send your acceptance letters, like if you had again anatomy that you were taking, we need you to take that course. So when we have when we send you your offer and you write back, if you have any outstanding.
And then with that spring, like last science credit, can that be a 4-credit class with a lab? Like, can it be anatomy with lab?
So if the last science class in the spring has a lab, is that okay? Or do they count as two
Yeah.
separate things? No, the lab is sort of lumped in. So if it's 3 or 4 credits, or even 5, if it's a 2-credit lab, we would lump that all into just the one.
Great, thank you.
Natalie, a Zoom question first.
Hi, Ellie is asking, do you have PT students who are active within research labs on the Greater Anschutz Medical Campus, but not necessarily working on rehab medicine?
So the question is, do we have students working in research labs on campus, whether or not they're associated with the PT program or the campus as a whole?
The exact answer to that, but it is possible. So the vast majority of works studies, I'm aware of work for part of the CUPT faculty. However, work study is a program that's campus wide.
In terms of clinical education, if there's a community you are very interested in serving or learning more about, but it's not part of the established relationships that CU has with clinicals, are you able to help as a student establish a rapport and relationship with them and create a clinical placement in any way?
I have the pleasure of getting to say the phrase that our PT students hear on a daily basis. And I'm sorry, the question was, I think if I can paraphrase it, do students have an opportunity to develop new clinical relationships for their part of our established like contract with partners? And so that's the answer, it depends. One of the things that we're really committed to is being the best clinical partner or best academic partner to our clinical sites that we can be. And so it used to be not very long ago that in these types of presentations, it was a real selling point of like, we have 500 contracts, we have 600 contracts. But us and other programs have started thinking, how can we have meaningful relationships with 500 or 600 clinical sites? And so we've become more selective about opening additional sites because we do have about 425 current contracts. However, if it's a site or if it's a clinical experience that offers something really unique that we don't have a lot of, we're always willing to have those kinds of conversations. And of course, for those who are interested in the hybrid pathway, it's a little bit different because we do want people to stay in their home communities if they so choose, or in clinical opportunities in those home communities.
Yeah, so for the hybrid pathway, are there opportunities to practice clinical skills outside of the immersion times if you live close to Colorado Springs?
That's a beautiful, so the question is, with regards to the hybrid pathway, is there the opportunity to practice clinical skills outside of the immersion time? And the answer is absolutely yes. So part of our development of skill acquisitions, we want, like, literally, we're throwing around the number 20 to 25% of that to happen during the asynchronous time. So that might be something as identifying a spouse, a significant other, a community member, and say we're working on, the knee and looking at range of motion of the knee, right? So you could, try to use your spouse, your family member as your patient resource. There's no doubt, like when we think about, all right, I'm a cardiopulmonary guy, so heart sounds, breath sounds. Your dog, right? I mean, anything you want, right? Now, the idea is you're starting down that path of skill acquisition in the asynchronous time period. And there's going to be give and take with you and the faculty, right? Like maybe it's you filming yourself doing X, Y, Z, and then the faculty member saying, "Hey, you did great, but don't forget the bony landmark is here, and you want to put the measurement device there." And then when you come down for the immersion, we get to. And I really like the word perfect. We really get to perfect those skills, and then complementing all of that, of course, is our clinical partners and our clinical education curriculum, where you really get to apply it to the patient populations.
Cool, thank you.
Going back into the PT research, is there any specific way to get involved with it without being a student, or do you need to be one to actually go into it?
Can you be involved in the research without being a student?
While or without being? Like, could I do it right now?
So there are volunteer appointments. So I've had a few people approach the lab if they wanted some experience or to get to know like what before they apply to either the PhD program or the DPT. So I think the short answer is yes.
Yeah, so for prereqs, for the science GPA, how do you go about calculating, like, what goes into that? Is it just based on your prereqs, or is it all the science we've taken? What goes into calculating that?
Great question. So the question is, for the science GPA, how do we calculate that? What courses? Full science. That includes the prerequisites and any other course taken. And again, this is maybe a question that we can email and detail for you. Largely speaking, it'd be any course in the chemistry, physics, biology departments. Or like your biomechanics, exercise physiology, but ones that we do not count are your more social sciences. So none of the psychology, no sociology, no anthropology would count towards that. And even some of the exercise science or kinesiology courses are like kind of a little questionable in terms of, is this a hard science? Like if you are learning examination of the lower extremity, well, that's not quite a hard science. And so a lot of those maybe are not counted. So kind of if we were to really define again in those chemistry, biology, physics, engineering, are very like the clear answer A, B science versus some of these other versions. Does that help? It's a little vague. And so again, what might help is if you're questioning, contact us, show us your transcript. We'll be able to outline for you exactly. Yeah.
Thank you.
If I were admitted to the residential pathway, I attended it, is it possible to then transfer to the hybrid pathway?
Great question. So for our Zoom attendees, the question is, if I were admitted to either pathway, could I transfer to the other one? And our short answer is no. Long answer is we know that there's some extenuating life circumstances really be advisable for you to switch to one or another for a variety of reasons, but we would only look at that on a very case by case basis. But we hope through your application, through interviews, through attending campus days, so on and so forth, that you've done your due diligence about picking the pathway that you feel fits you best and are admitted to. We hope that then you take that pathway. So on the application itself, you'll be asked more essentially which pathway is your preference. And then it'll sort of say, you know, if your preference is residential, but you would, and only residential, tell us why. If your pathway is only hybrid, tell us why. If your preference is residential, but you'll consider, so we sort of have these four, like only, and then preference. And again, we know that that may change. That's why we ask over and over again, are you like, has this, once you came to campus or went and saw the Hibble Center, you're like, that's it, done, I'm going to the hybrid. That's, you know, so we understand that your thoughts may change.
How does the year-long internship option compare to like a residency? And we talk a little bit, if you can, about residencies at CU?
Yes, great question. So the question was kind of twofold or two-part. First, talk a little bit more about the year-long internship and what that is, and then how is that different from residency? And do we have residency options on the CU campus or within the CU program? So the year-long internship is, the way I most describe it is that first year of being a physical therapist is a very steep learning curve. We do our best to graduate journalist physical therapists, but we're kind of at the floor of what people should know. And then as you move forward in your career, you just gain experience and knowledge, but it's a steep learning curve in the first year. At least it was for me. Sorry. How I think about it is the year-long internship softens that curve a little. So you have this more dedicated mentor, time blocked out for more dedicated mentorship as a new grad. so that you can continue to hone and grow some of those entry-level skills. The trade-off is the year-long internship typically does come with a slightly reduced salary because you're not seeing as many patients and billing for your services as much. And so there has to be a reduction in salary to kind of offset that additional cost of mentorship. But I think it could be a really valuable program for many individuals. What's different about that from the residency is we're still focusing on generalist skills within the year-long internship. Residency is about a path towards specialization. So we have residencies, there are board certifications within the profession of physical therapy. I think there's 9 currently, orthopedics, pediatrics, there's a whole bunch of them. Residencies basically end at your ability to sit for that board certification exam for specialization within whatever that specialty was. So residency is above and beyond graduating from an entry-level generalist physical therapy program. So then you also ask, do we have them? And we do. We have 3 residencies affiliated with our program. We have a pediatric residency in partnership with Colorado Children's. We have an orthopedic residency in partnership with University of Colorado Health System. And then we have a really unique residency, a faculty residency. Probably that's not going to be of interest to people who are just graduating from PT school, but we're one of 3 programs that have developed a residency to actually help clinicians transition into the world of academia and teaching. Probably one more question. And again, you're seeing our current students filing in, and they're going to be able to answer a lot of your questions as well. So last question there in the back.
Yeah, hi. In terms of the hybrid program, how exactly does mentorship, especially like faculty mentorship, work and interactions with your other cohort members in that program?
So let me make sure I got the question
Yeah.
correct. So in the hybrid, how does student faculty mentorship occur?
Yeah.
Is that fair?
Yeah.
So every incoming student is basically assigned a faculty advisor. And one of the things that the hybrid program in general, hybrid faculty specifically, one of the things we hear as a challenge in all hybrid programs is that faculty-student engagement piece. So we're purposefully trying to nip that in the bud a little bit, right? Like, so we're going to have more scheduled, more frequent faculty-student advisement sessions that start pretty much at day 1. Even though our orientation, our initial orientation, you saw, May 30th, 31st is virtual, we're going to have orientation activities during that first immersion. And that's going to not just happen only at the first immersion, but at the second and the third, and the whole idea is to build a community of practice, not just student to student, not just student to faculty, but also faculty to faculty, student to the community, because we want our students to feel a part of this Colorado Springs region. That's part of the reason we developed this, is to meet the need, of everybody in their own communities, but also to meet the needs of Southern Colorado and some of the rural areas of Colorado, New Mexico, and the whole surrounding area.
Thank you.
All right, so thank you so much for your time. I know a 2-hour presentation is quite long, and those of you on Zoom, thank you for attending. We just really appreciate your Saturday morning spending with us, learning about the program. For those of you that are here, we have a tour ready for you. Our students are eager to tell you more about their experiences. The restroom, water, a snack. Just speak up. We can stop along the way. There's no problem there. And again, those of you on Zoom, thank you so much for joining. Utilize this email, pt.admissions@cu. Our fantastic team of admissions advisors ready and available to answer your questions. Our students are going to spread out there in pairs, and we'll have them spread out. If you can sort of just try and break yourself up, maybe about 5 or so people in a group with your guests that you brought. Maybe students spread around the room, and students, don't leave till I come find you, because I'm going to send each of your groups to a different starting location so that we all follow the exact same tour and bombard all the same locations at this So we'll go ahead and break up. Thank you.
You're gonna come out, okay?